Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for checking out this video. You're here because you have some questions about the harms or the benefits of mouth rinse, or maybe some other ways you can fix your bad breath. Now, especially if you have implants or veneers, or you've had major transformative dental work, we see this quite a bit where people start to get more stains or discoloration, or their gums get sore around implants, or teeth that have had veneers or other things. And there's a lot of misconception about mouth rinses and what they actually do. And the problem with mouth rinses is they're kind of like a grenade. They can be cytotoxic. They're indiscriminate. What I mean by that is when they go into your mouth, they don't just target bad bacteria, they target everything. So they kill the good and the bad. And just like any major bacterial infection is, if you kill too much of the good bacteria, the bad bacteria can actually come back more aggressively and overgrow. And so this is where I personally do not use a lot of mouth rinses. There are some more gentle ones that I use, but a lot of the major brands that have alcohol or harsh detergents, or that say kill bacteria, I don't use those personally because I actually find those do more harm than good. And in just a second, I'll get to some things that may actually be even better for you. But some examples of this are studies have actually shown that overuse of mouth rinse can cause canker sores, it can cause worse breath, it can cause gum disease. It's possibly even able to cause things like oral cancer, because chronic exposure to things like alcohol can lead to cancer. And so when I look in the mouth of someone who has lots of cavities, or they've lost a lot of teeth and had implants, or their implants or veneers are having problems, we look at the total health of the mouth, not just the teeth or what they're brushing or flossing with. And one of the best ways you can get this figured out is with a saliva test. And the saliva test is kind of like a blood test, only you spit into a cup rather than having your blood drawn. And for us, it's one of the best ways that we can come up with a customized plan on how to really get your mouth healthy, not just brushing and flossing or and using mouth rinse. Now, the key to a healthier mouth, healthier gums, better breath is having the right kind of bacteria in your mouth. And one of the things that we test for when we do your saliva test is ammonia. And ammonia, if there's high levels of ammonia in your mouth, that can mean there's overgrowth of bacteria, which can cause the bad odor, bad taste, bad smell. And so personally, what I found is even more effective is I use a tongue scraper in the morning, and then I use dental probiotics. Now, you may have heard of gut probiotics that you would swallow orally that help your digestive system. And if a digestive system has had too many antibiotics, it will get dysbiosis, which can cause a lot of problems. And more studies are linking gut dysbiosis to cancer and Alzheimer's and diabetes. Our mouth is connected to our whole body, so it's really not that much different that if our mouth bacteria are out of whack, that can cause problems in our body because it's connected to that same tube. So probiotics that are formulated for the mouth and tongue scraper are the two keys that have really helped me and have helped many of our patients. So if you have specific questions on what types of oral biotics we're currently using, what type of tongue scraper to use, please don't hesitate to reach out. You can call us, you can email us, and we'd be happy to share with you some brands that you could look up with online. Or if you'd like a saliva test, you can contact us about that as well and find out how to get a saliva test. And you don't even have to live near us to be able to get that. We can actually have those shipped. So hope this video has been helpful, and we look forward to seeing you on the next one. Have a great day.